Okay. Bonjour, everyone. Hello, my name is Misha LaPlante. I am the Senior Program Specialist for the American Indian Cancer Foundation. Thank you so much for joining us for Indigenous Pink today on Thursday, October 21st, 2021. We are so glad to be joined by Louise Matson. Louise has graduated from St. Olaf College with a bachelor's and later received a teaching license from Concordia College for grades 1 through 6. She founded and operated the first Boys and Girls Club located in a school in Minneapolis before being hired at the Division of Indian Work in 2002. She directed the Youth Leadership Development Program before being hired as the Executive Director in November 2014. Louise served as a mentor for Big Brother, Big Sister for over 10 years and was a founding board member and is the current board treasurer of Bdote Learning Center, a Dakota and Ojibwe immersion school located in South Minneapolis. She is also co-chair of Phillips Indian Educators. We are so thankful to be joined by you today on Indigenous Pink to hear more from you about your experience with breast cancer.
Well, thank you for inviting me. I'm very glad to participate today.
Yeah, and thank you to all of the attendees as well who have been joining us both through Zoom and Facebook. If you have any questions, please feel free to drop them into the chat, either through Zoom or on our comment section on Facebook. So for those who don't know, we do have a few questions lined up for Louise today, so we are going to get started with that. So Louise, can you please tell me a bit about yourself? Where are you from? What do you like to do? What brings you joy?
Well, so I am White Earth Band Ojibwe, but I'm born, raised, and still live in South Minneapolis. And I have my dad is a White Earth member. My mom is not Native, and I've always been an urban person through and through. But one thing that gives me joy is I'm a big reader. I also sing with a group of women called Asiganak Singers, and we do hand drum singing together, and that's something that I love to do. It's very casual, but it's a group of women from community, and that's one thing that we spend time doing, of course, prior to COVID. So we're getting back to it again.
Thank you for sharing that. That's really powerful. And it's nice to know that there are singing groups out there. I always envision those vibrations reaching all of our relatives. Thank you. So you are here today again to talk about your experience with breast cancer. Can you please tell us a bit about your cancer journey? When and how were you diagnosed with cancer? What were your signs and symptoms, if any?
Well, I was diagnosed with stage 2 breast cancer in end of January 2020. And the reason I went in was because I felt the lump in my breast. So I, knew that there was something going on. And yeah, it was pretty much January 2020, and the entire cancer journey was the whole year of 2020. Through diagnosis, treatment, surgery, and then radiation. It's kind of wrapped things up the end of last year, although I still continue on medication and physical therapy, for the time being. So.
Thank you. So you talked a little bit about your treatment situation. Do you want to kind of elaborate on that?
Well, yes, and I was talking about this a little before because I was not aggressive about knowing that this lump was not okay. I mean, the first doctor that I went to, I'd stopped seeing my regular doctor and very much downplayed the fact that I had a lump and, could be a cyst, and I was scheduled for a regular mammogram. So basically, I felt this lump 2 months prior to when I went in for the diagnosis. But she told me, that doctor, what I wanted to hear, which was probably nothing. So I waited 2 months to go in for a regular mammogram, and they wouldn't give it to me because I told them I had a lump in my breast and I was supposed to go for a different kind of mammogram. So that happened really fast. And then the first doctor that I saw wanted me to just jump right into chemo, just jump into, you need chemo, we need to do it now. And, it was scary. It was a lot of information, and this is the surgery you could have, and these are the side effects. And but I asked around. I kind of pulled the brakes on it and asked my other women, my friends, my women colleagues, and who I knew had either had cancer or knew someone who had breast cancer, for their recommendations. And I'm really glad that I did, because I ended up with an awesome team of an oncologist and surgeon. And my oncologist was very, very aggressive. So she said things like, we really need to know how big is your tumor, because I had heard different things. It's hard to tell. I also didn't know there was such a thing as dense breasts, which I apparently have. So it's hard to tell. And she said things like, well, sometimes insurance doesn't want to pay for it, but we're going to do it. So I had an extremely aggressive doctor who did all that. So we could really figure out how big was that tumor. What was my oncotype score, which I didn't know there was such a thing. And that's your likelihood of could your cancer return? Also genetic testing. Do I have the BRCA gene? All these kind of tests that could help with my treatment. So I found out, and she also said, because breast cancer is so well researched, that I could qualify for any number of drug trials should I choose to participate, and if it's safe for me. And so that's exactly what happened. So we did all this testing, and she recommended a drug trial for me. And so I participated in a drug trial for the entire, months of the entire summer, I would say, for months. And, I was asked, one of my friends said, why don't you just take it out? Just get that cancer out. And I wanted a lumpectomy. So I wanted to try to shrink that tumor so I could have a lumpectomy instead of a mastectomy. So it's a much easier surgery to recover from. And so that was my goal. And that's what happened. So, and there's also helping other women, right? We have drug trials so we can see what works or what doesn't. And it was a pretty safe thing for me to do because my tumor wasn't fast growing. So I wasn't worried about that. But all that was explained to me by my really incredible team, and they were at Piper Breast Center and Minnesota Oncology. So I was able to have surgery in September, a lumpectomy, followed by radiation. So I was grateful to be able to be in that treatment. And I think the drug trial was $100,000 drug trial that they paid for, which tells you, kind of the state of our that kind of treatment would cost that much money. That would be out of reach for a lot of people. So I was really grateful. So that's, do your diligence and don't agree with the first doctor that you talk to, is what I would say, because I think if I would have followed that doctor's advice, I would have gone through chemo, which might not have really helped me. Would have helped a little bit, but not appropriate for my tumor.
Yeah, I was just listening actually to another interview with someone else who participated in a clinical trial, and she was talking about a very similar experience to yours, and that if she hadn't advocated like you advocated as well, she would have had a different treatment that just really wasn't aligned with what she wanted to do for her own body. One question, I'm going to veer kind of from our guide that we have, but I'm curious, like, how did you kind of empower yourself to actually make the decision to seek another option? Because sometimes people don't know that they can. They just kind of are told, they think the doctor is the authority, or they haven't been empowered to do that before themselves.
I don't know. I think, I am a little bit older. So I think I'm a little more, where maybe if I was younger, I would have been, because I have been in that situation where you just let the doctor just roll over you. And I think when I was younger, I had an experience with a doctor that made me think never again, and which also made me want to work with female doctors only. So I wanted also a female doctor. I think especially for breast cancer, I wanted and I had like an entire team, everyone involved in my treatment were women, with the exception of maybe one or two nurses at the radiation place, but they're all women. So I loved that. But yeah, I think part of it was just that I'm a little bit older and I'm a little bit better at advocating for myself that I wouldn't have been as a younger person. But I think just slowing down because it happened so fast, and just I needed time to think about it. And I think that's a piece of advice I would give is wait. You're going to get a lot of information if you get diagnosed with breast cancer, and it's a lot to take in, and just don't make any decisions till you can think about it and ask questions. Because I respect doctors, and they're smart, and they worked really hard to get where they're at, but they're not all at the same place or the same skill set, or they need to kind of sometimes slow down too. It's an urgency when you have breast cancer, but it's just a lot of information to take in. I kind of veered off that answer, but I just think it's worth just being assertive. Remember to be assertive when you're in that situation.
Yeah, I think those are really good reminders. So thank you for sharing that. And I guess this is kind of related, like talking more about like your feelings, like what did you end up thinking and feeling about your treatments?
Well, it was scary, when you first get that call that you have cancer, but, I had prepared myself because, of how, I had known that wasn't, something was wrong. But my treatment, I was able to work, and the drug trial didn't make me sick. And so I really had very little side effects. So I was able to keep working. And I think that was really important to me because I wasn't sitting at home, thinking about it. And then of course, COVID happened. So that did impact every aspect of my treatment, because people couldn't come to my appointments with me, and for a while couldn't even sit in the lobby waiting for me. So very much people that had cancer last year in treatment were alone. And I saw that when I would first go to Minnesota Oncology Center, go meet with my people in the back, and I could see where people were getting treatment, chemo, where you kind of sit in a chair and you get the medication, and people had friends they had, family there, they were talking, they had support, and that changed fast. Within 2 months, everyone is alone. And that was hard. Also because of COVID, I didn't really, go to groups or try to go to ceremony. None of that was happening. So it's very much more of a lonelier journey last year. But again, I felt good. I never, I had, the lump was located in my lower left breast, which I did not know that most women get breast cancer in their left breast. It was uncomfortable because it was so big. But other than that, I had very little side effects. One thing that I still struggle with and have is, my cancer was estrogen positive. So the medication I'm on, I think this happens to a lot of women. Well, if you have estrogen positive cancer, you will be forced into menopause. And then what happens is that's a lubricant. My joints, everything is really stiff. You get really stiff. And then you don't want to exercise. And then you go through metabolism, and you might struggle with weight gain. So that kind of stuff, those body changes also happen at the same time. So that's something that, I wish I had, kept exercising more, but I'm going to give myself grace. It was a lot going on last year. So.
Yes, there certainly was a lot going on, and is still going on. And then added with all of the ancestral, generational impacts of just what has happened to our people, our relatives, in a lot of ways, that makes it really difficult. And knowing too, all of the work that you do in the community. Yeah, so spoke a little bit about it as far as like receiving or having certain barriers to care, and maybe not so much care, but also just like care in the sense, I should say, of how you were able to bring other people into the circle with you into your treatment experience. Were there any other significant barriers to receiving treatment?
Um, well, aside from, the COVID, then I'm working on Lake Street and I live in South Minneapolis. And so last year after the murder of George Floyd, everything exploded around here. And then also I go to treatment at Piper Center, I used to walk down there. And I like walking, but it was a little unsafe to walk for a while. And frankly, it still is not safe to walk over there sometimes of the day or night. But yeah, I just think, I didn't really talk about it much with people, which would have been helpful. But because it was such the COVID time and then everything that happened after the murder of George Floyd, there was just so much going on that, I just didn't probably reach out. I would have liked to have gone to ceremony. I would have liked to have gone to a dark room ceremony. But that just wasn't possible last year.
Yeah, thank you. This is actually kind of related. So, since you weren't able to go to ceremonies last year, have there been other ways that you've incorporated traditional healing culture? And then maybe not just since last year, but also now this year, since you're able to focus on it in a different way.
Yeah, I think, well, people have given me some teas and some medicine that no, because I told people at DIW, I mean, it's not a secret. And then as I would talk to people in the community that I work with, that was going on. So people would give me some medicines, um, teas and different things, plant medicines. But, I would like to be in an in-person group. So that is my plan for moving forward. And I don't know where the time goes, but because I'm a big believer, I like to go to groups. I like community. And I think that hearing other people and just some other people that have had cancer is comforting. There's one thing that happened too with being so isolated with COVID, with cancer during that time is it's a tremendous burden on like my family or my friends because they had to hear everything. like, which I think I would prefer not to do. Like it's a heavy burden to put on somebody, like you're like my mother, she's already worried, so she doesn't need me to tell her the day-to-day stuff or put that on her plate too. So, but yeah, I think that's the only way I was able to do it was just people gifting things like that to me and helping in that way. Or a lot of people would say, I'm praying for you. A lot of people said that, and that meant a lot to me, in a traditional way, or, that meant a lot.
Yeah, that is really meaningful. And I have heard, yeah, other people talk about how support circles or talking to other survivors is really helpful because, like you, they don't want to burden, or I mean, many have used that word, they don't want to burden their families and friends with some of the same information. So it's nice to have those spaces for sure. And I like that you want to do it in person because it is important.
Yeah, I like that. And like everybody else, I like to go to classes. I used to be a teacher and I'm very teacher oriented. So I like a leader that will guide the discussion. So, and so, yeah, I need to do that. I've been putting it off, but then I have to think that's kind of what got you here in the first place. You put off, you didn't take care of your health, which I think I'd mentioned earlier is, I could have caught this cancer earlier before it spread to my lymph nodes, but I stopped going to the doctor about 6 years ago. I was so diligent in my teens, not my starting in my teens, but my 20s, even when I didn't have insurance, I was going to Planned Parenthood, just taking care of my health. And then I just simply dropped it. I dropped it. So I hadn't had a breast exam in like 6 years. So I feel like if I had been doing that, I would have caught it earlier, but I didn't do that. So this is the same thing. Oh, I said, I need to get to that group and I haven't done it yet. And what is it? It's October. And we're starting to meet in person. So I think I see a pattern there. So
Noticing those patterns is really helpful. um, so we're going to kind of transition actually to a question here and circle back to some of the things that you talked about at the beginning. So someone through Zoom has asked, pertaining to the beginning of your journey, what advice would you give women who tend to downplay something they may fear pertaining to their health?
well, I mean, don't, just face it. Don't, it's hard, but I think we as women, we tend to also look out and care for other people. And so putting yourself second, and I know people are busy and, everyone, it's been a hard year or so, but I think just to just um, meet it head on and ask a lot of questions and ask for help, and ask other people. So even, that's how I've got my great team, is I asked other people and the same names kept coming up over and over again. It's Dr. Sy at Minnesota Oncology, Dr. Johnson is a great surgeon. And so I was able to advocate instead of listening to the first doctor I saw that was like, hey, we're going to start tomorrow. But yeah, it's hard. I think we all, when you're faced with something scary like that, to try to put it off or ignore it, but it's not going to change. And again, don't do what I did, was listen to what I wanted to hear, which was, it's probably nothing. I knew it was I knew it was not probably nothing, because it was kind of a big lump, and that I knew, but I heard only what I wanted to hear. So got to fight that, I think, in ourselves, to not to try to avoid something that is scary. So I mean, we all have to fight that tendency, but just know that, because it's not going to get better in anyone's case with a breast cancer. It's not going to get better on its own. It's not going to go away. It has to be faced.
Yeah, thank you. So I guess speaking of things that you kind of wish you had known or wish that you had done, what did you wish that you knew during your cancer journey?
Well, I think one thing that the cancer team did for me that I think is really important, and I think that I would urge everyone to do that. And I'm not sure if every doctor does that, but I had a nurse taking notes, because I didn't really know. I mean, going back from the beginning, I didn't know there are different kind of mammograms. I didn't really know what all went in the process too of going through a breast cancer treatment, and didn't. It was just so much information, and I did have someone taking notes. I wish I would have just followed up a little bit more, especially in preparing for the surgery. Um, I I knew what was coming. I knew what they were going to do, but I didn't know. Like I had a drainage tube after that. I'm like, when I have to have that? I didn't realize. I must not have caught that. Um, or I'm going to be, yeah, I mean, just things I should have prepared more for the surgery. But they told me, but it's a lot of information. So it's worth going back. You get a ton of stuff, and reading it, and then asking questions, and making sure if you have someone taking notes for you, so you remember all the things that they tell you to prepare for surgery, after surgery. So, like, I'll be pretty frank. Like, I got really constipated. I didn't expect that. I should have prepared, and I should have taken something for that after surgery and I didn't. I'm sure that I was told that. And then I look back at the stuff, well, this might be a symptom, and I should have prepared, because that was really painful. Very, very painful. And not even right away after the surgery. And I just didn't prepare that way. I should have. I would have saved like a a weekend of kind of being in a little bit of pain from that. So, but it again, it's just a lot of information. It's a lot of, you get a lot of information. So trying to follow up and read that, reread it, read your notes. So.
Yeah, I think that is really, really helpful. And I like the message that you have shared a few times, is just like slow down and actually sit with some of the things that you are actually being presented as far as information. Yeah, sometimes information overload happens where it's really hard to dissect actually what's being said.
Yeah, and it's going to happen. You'll get a lot of information, and especially like the options for the drug trial. There was a whole page of different options, and then the medical terms. And I still struggle with that, to be honest, because I think it's nice that you get my chart, and everybody gets my chart now. But when I get the my chart stuff, sometimes I look at it and it doesn't mean to me anything to me to see a lab report that says like less than 2 milliliters. Like, what does that mean? I need it to be interpreted. And that's really a handy tool to have, but it's only as good as if you understand what does that mean. So right now I get a shot every month to make sure I'm not making estrogen. I want to stop that as soon as I can, because I don't, once I'm in menopause. So they're testing my blood to make sure to see if I'm in menopause. And so, but I don't need just the results. I need you to tell me, does that mean? So I have a doctor appointment on Monday so we can see where that's at, because I need a doctor to talk to. So you don't always get that in the my chart. You just get your results. And how do you interpret your results? You still have to talk to your doctor. And I think that's a good thing, to talk to your doctor.
Yeah, I think that's really helpful. You bring up a recurrent theme around here these days, which is health literacy. And on the other side of it, like how do we make it more accessible to our community members so that they actually understand what's happening?
Yeah, there's a lot of crazy terminology. I mean, it's like, oh, you're HR positive, or you're estrogen positive, HR negative, or all these acronyms and these terms, all these different kinds of breast cancer. And that would be a big help, I think, to many people, including me, who I learned, and I had good doctors that explained things to me. But it's so alien if you're not in that field. It's just completely different. It's a different language than like I speak working at my job and the things that I do.
Yeah, definitely. Were there any resources that you found really helpful to kind of explain some of the questions that you had?
Well, I just would Google stuff all the time, but you have to be careful. You could scare yourself with some of that stuff you see on Google. But I would look up a lot of terms and look at, there's the Cancer Foundation. So there's different websites that you can go on and look on, or Susan J. Komen or whatever. I would kind of noodle around sometimes and for resources. And there are, there's support groups. Like you said, you have a support group for Cancer Foundation, and there's like Gilda's Club, and there's other places to go to. And then, so that was probably and because of COVID, like the best resource for me was like online and looking up things online. But again, like you said, you have to be careful, because it's either incorrect, it can be correct, or it can just be pretty scary.
That's also a very good reminder, yes. Just to slow down, I guess, even with some of the things that we're researching.
Mm-hmm.
I'd like to circle back to how you've mentioned COVID a few times. Is there anything that you want to say more about like treatment, recovery, and survivorship during the pandemic so far?
Well, it's just been, it's been incredibly hard for everybody. But I just want to say I am, so grateful to healthcare providers. Like that, when I got my vaccine, I was so emotional, like, because I could feel comfortable going in the hospital, because that was part of here we have cancer, we don't have the vaccine. We're seeing our doctors and our nurses and our radiologists, and we're close. We're masked, but we're really close, and we're close for a while. And I just couldn't believe it. It's like, because that's just me. I'm going to see this doctor, but they're seeing multiple patients all day long at great risk to themselves, and I would always, I'd say, oh, thank you, thank you. And my doctor said, cancer is not going to stop for COVID. So that's why we're doing this. And so for me, I was so grateful to get the vaccine, not just for myself, but that I feel so much more comfortable going in for treatment, because I had this incredible guilt and worry that I'm going to get my doctor sick or my nurse sick. I was never immune compromised. I never was for my treatment. That's one thing that they tested. I would go in for blood work every week. So I wasn't really worried about my exposure, because everyone's really careful. But I thought, gosh, these doctors, multiple people all day long, and nurses all day long. So I guess that was, that made it, I was a little bit felt guilty or felt worried about that. So that didn't help with the treatment. But yeah, I think it would just made everything harder, and support, people to talk to about what was happening just wasn't there. I think I texted my best friends, oh, I have breast cancer. I'd rather, let's talk about that. I'll see him for coffee, but that just, I was just before shutdown when I got diagnosed. So, a month and a half before, but, you don't see everybody in that time, but I'm kind of rambling. I think for anybody that was going through an illness during COVID, everything changed. And I think I worry that people, women, are not taking care of themselves because of that as well. I can't get in for a regular breast exam, and can't get in for that preventative care. And it's really important. It's, again, had I maybe got this cancer earlier, I wouldn't have had to take out 11 lymph nodes. And I haven't had lymphedema, but that's a side effect that you can get when you take out your lymph nodes. But the other ones apparently have taken over. Whatever's going, that's the goal, is that those lymph nodes. But that's a side effect that I could have dealt with because the cancer had spread into the lymph nodes. So I want folks to be able to get the care that they need so they can get it, earlier is better.
Yeah, that is a very important message for a lot of our relatives. Speaking of our community members, what do you want to tell other Native people about cancer?
Well, I think that, I know we have higher cancer rates in our community. And I think the way it was explained to me when I went to the genetic counselor, the woman that was checking to see if I had that BRCA gene, like what are the markers? And she said, like it's a glass of water, and we might start with a little bit in the water for our genetics, and then with our environmental factors, and then whatever else tips it over. I thought it was a really good visual in my mind to think about what happens. And I think that for us as Native people, we have to be extra vigilant because of our other health challenges that we might have, like in our community with some of our access to healthier foods, and what are the environmental aspects of living in South Minneapolis and the polluted ground that we have in South Minneapolis. I know around here in the Phillips and the Powderhorn neighborhood, the ground is heavily polluted with arsenic and lead. So what contributes to like a cancer diagnosis? I think we might be, being exposed to that because of maybe the places that we live, or the kind of healthcare access we've had before makes us more vulnerable. So I think for Native people, and there are so many great options for us to seek care, that there are a lot of places to go that, depending on your insurance or lack of insurance, or if you want to go and make sure you're in a native serving clinic like NAC or IHB. There's just a lot of options for our care that we have. But I think because we have a lot of risk factors for a lot of different reasons, that it's really important that we make sure we're getting that preventative care. Go get your colonoscopy. Go get go to your exams. Get that breast exam, get that mammogram.
Yeah, that very resounding message, I think, from you on your end. Speaking of kind of what some of the things that come up as a Native person, are there things that you would like maybe providers and healthcare staff to know more about Native patients?
I wish they could that they should understand that there are traditional medicines and practices that Native people will be using, and also bringing to the table and respecting that, and understanding that and not challenging that. And that wasn't, my experience, but I know that it happens, and understanding that is an important part of healing, is seeking out those resources. Like, we have medicines that we know are work for our people, and then we have ceremonies and we have practices that we want to use. And so I think that the hospitals here understand that more because of work of folks like Lisa Shefji, who worked at Children's Hospital, and Aida Strom is at Hennepin Healthcare. So being advocates for Native people and our healthcare needs is really important in a big, huge hospital system like that. And also we have doulas that go out and work with our moms, so that hospitals can understand that maybe that mom wants to smudge, or there's practices that the people are going to have that need to be respected. And so I do think that, because of the work of like those two women I mentioned, that there's a better understanding in Minneapolis, and then work like what the Cancer Foundation does. A lot of it is just understanding the Native community, and understanding that we have a large and diverse Native community here in Minneapolis. So that's important for hospitals and healthcare professionals to know.
Yeah, you just spoke about two really amazing women out here in Minneapolis, including, of course, yourself, but just talking about how we have certain community health workers, patient navigators who really understand what it means to be Ojibwe or to be whichever tribe they may be from. That's really important and really helpful to have that in our communities.
Mm-hmm. Definitely. And that we have healers or people that might want to go to the hospital, and that are there to offer, prayers for people. I was just hearing about Nancy Bordeaux, who's another amazing person in the community that helps people understand. Like, she would go to the hospital to help with the family and help pray with someone when they're passing on. And so that there's people like that out available to family, that should be not a surprise to a healthcare provider, that there are different, experts, healers, when, especially women, that will come out and help families in the hospital.
Speaking of community, we have a comment from Facebook. This person said, I have cancer. Sisters, as I went to a group at the YMCA several years ago. Our group fundraised for Live Strong through the YMCA every year, and we buy a table. We get together for lunch, not as much during the pandemic, but we're still meeting. You spoke a little bit about your connection to some of your friends and your relatives. I know this isn't part of the interview guide, but I'm also interested in kind of like hearing more about like your connections to others, as well as maybe how caregiving showed up for you, if at all.
Well, I think so. The caregiving, you mean for me, who was caring for me, or yeah, primarily my husband. I don't have children, um, and so I have a lot of nieces and nephews. I love being an auntie, but they're kind of all scattered all over too. And there's COVID, so so he had to bear a lot of that burden, like before surgery, I had to get tested for COVID, and so did he, and then we had to lock down. But just having to do things, that I just couldn't do. Like I said, my treatment was fairly limited in side effects, but I will say the hardest part was that radiation treatment. And they say after radiation that it builds up and you get tired. And I was tired and I didn't realize how badly I felt till I felt better. Like a couple months later, I was actually laughing and smiling and singing and more like myself. And I realized and I just didn't want to do anything. So he had to do everything. It wasn't like I felt sick, but I was very apathetic, very tired. So he was my caregiver, but also, you know, um, I have a strong group of women friends and a strong group of women I work with here. Like DIW is primarily women and really some pretty amazing women. And so talking to them or just them being here, understanding was a really big support. But again, I loved coming to work and I liked just as normal as we could during COVID. I mean, we also had stay home, but then we did stay safe. And this is a little bit off subject, but we were just talking about how people are happy to be back in the office. Like we have an option where people still want to try to work a day from home. They can through the end of the year, but most people are not doing that here. They want to come in the office. We're social creatures. We want to be with other people. And it's one thing I've always loved about this job too, is the connection to the Native community. So for me, being this urban Native person, multiracial, like I learned my languages, what I know, which is not much, from when we had Ojibwe class here for our kids. And David Butler was here and he was teaching Anishinaabe and things like protocol. And that's where I learned because I sat in the class with the kids. So I really loved that. And that's where I learn a lot from the other folks that are here. And again, we're really diverse here for tribal nations as well. But just to, that's getting that connection from DIW has been really important and a real blessing from me working here. So I see there's a Facebook comment.
Yeah, it says, my doctor said many couples don't make it through cancer. My husband was great and my caregiver for 8 months or for months, 8 months before I could go back to work. Even before diagnosis, it was like Louise spoke of.
Yeah, and it's not like I mean, I can see how hard it would be, and because somebody has all the that kind of care, and also like the most, things that I really wouldn't want my partner to, that I love him, but do I want him to check my drain, my icky drain from no, but he had to, and I was like, oh, it's not very, romantic. So not to make a joke of it, but it is when you're kind of at your worst and somebody has to see you that way and then also has to pick up the burden of all the stuff around the house. And like I said, we don't have children. I mean, even if we did, they'd be out of the house at this point probably, but just taking all that. We have a dog. I'm not walking the dog. The dog is all his responsibility. So but yeah, I think it's really, really hard on that caregiver because I think they also worry. They worry you're going to die. I know my husband was worried that when you first get that diagnosis, that he's worried that I'm not going to survive. So they have that going too.
Yeah, you're right. There are many considerations for everyone involved.
Mm-hmm.
And it's very complex and layered too, as far as like, of course, when we think about like our mental spiritual, physical, and emotional health.
Mhm.
And life doesn't stop either when you're diagnosed,
No, no. And I'll say another thing with the COVID that really interfered with because my plan was after I finished treatment, um, and felt better, I wanted to have a 80s dance party because I'm an 80s person, but I haven't been able to do it yet because it hasn't been safe. But I really want to do that. I want to have a celebration, because it's not over yet. I'm still, but I'm on the other end of the worst of it, I believe. And so I wanted to do that, but, can't do that yet. It's not, I don't want people to be exposed to COVID, but I'm just dying to do some kind of thing like that, because we also couldn't get together for other things like birthdays or reunions or holidays, which we are doing now. But that's my goal, is to do something like that as soon as it's safe.
Yeah, I love that. I think that's wonderful. And that you definitely deserve to celebrate yourself this way and those around you. That's awesome.
Yeah, and as like a thank you for people for helping, because also people, as far as the caregiving, I got notes, letters, and then I also had people did meal train. So after I had surgery, I had people bringing meals over, which was so great, and it's nothing I would have asked anyone to do for me, but, one of my nieces organized it. And so that was very, very helpful. So those acts like that. And so I try to think of that, like I'll even just having a card that says, I know that you're going through this. I think some people maybe are afraid to mention it or to bring it up. But again, like I said, it's not a secret. It's nothing to be ashamed of. Now, some people are more private and aren't going to talk about that. But if you know somebody that has a diagnosis, like even just dropping a card or something saying, thinking of you, if you need anything, let me know, or, organize a meal train, like I said, or some way that to help people, or just to let them know that, I'm thinking of you and you're in my thoughts, and I don't have to talk to you, or I know you might be overwhelmed right now, but that other people are thinking of you while you're going through your journey. So
Yeah, I think those are good tidbits. I know that we often want to know how can we be more supportive relatives to one another. So thank you for sharing that. So we only have about 11 minutes left. So I'm curious, what did cancer teach you about yourself?
I guess that I'm stronger than I thought I was. Um, I can get through it. This too. Just also looking, need a little more planning, a little more not taking for granted, I guess. I went right back to that doctor I stopped going to about 6 years ago. And she's still there. I'm like, why did I do that? So, being better about taking care of myself. But yeah, I learned that I'm pretty strong. I never thought I'm afraid of needles, and I thought, oh gosh, how can I do this? Like, I got better at it, and I did it. So just everything that I had to do, I did it, and so it taught me that I am probably stronger than I ever thought I was. So I guess that's a big takeaway.
Yeah, that's a wonderful takeaway. And I just having known you also in the community, especially because I used to work at DIW too. I have always looked at you as a very strong person, and now have seen this even more. And love the idea of you celebrating yourself. And so, are there any other ways that you have been celebrating yourself or honoring yourself in this experience?
Well, I just want to get back to doing things that I like to do with community, like singing and drumming. We're going to do that. Actually, we have practice tonight. Um, being more, I just can't wait to participate more in community. So a lot of it was COVID, and then I was kind of afraid, like, but I look forward to the things that are going on, because we do have a really great community in Minneapolis. A lot of things going on and a lot of opportunity to just enjoy being Native people. So I'm excited for that and excited to be able to do that again, both getting over cancer and then also over COVID.
Yeah, those are really huge celebrations coming up then.
Yeah.
So I guess kind of just to wrap up before there might be any questions, what would you kind of like your main takeaway of this part of your story or experience with your cancer journey to be? And again, kind of why are you sharing your story?
I said to share my story to urge people to not neglect their care, especially women and especially Indian women, because I know how hard Indian women work. And, so I thought, well, part of me is like, everybody says that, like, don't, but I'm adding my chorus, my voice to that chorus. Like, please don't get too busy to stop, because nobody's that busy. We're all busy in different ways, but you have to do that. And it can make a big difference. And I'm glad that my diagnosis wasn't worse because of my neglect of my own health care. So that's my main reason for doing this and for sharing my story. And what I've also said, I say that all the time to the women that I work with here, because they're all younger. It's like, get that breast exam, go to the doctor. You know your body and you know when something is not right. Listen to that voice and don't ignore it. So that was my whole reason for coming along, was to add to that chorus of please take care of yourself. Please do those things. There's a reason we should be doing these regular checkups. So that's why I'm here today.
Thank you. I appreciate that so much. I'm gonna just check in with our audience to see if they have any questions. So you can type it into the chat. Otherwise, there is a Q&A box. And again, for those in Facebook, we do have someone monitoring the comments. So if you want to add anything there, that is totally fine. In the meantime, Louise, I wanted to see if there's anything else that you wanted to circle back on or elaborate on.
No, I also, to urge people to, and you said this too, is yes, it's very urgent when you get a diagnosis. And yes, you're nervous and want to figure it out, but to slow down, to know that you have options. Your first doctor, the one that tells you, might not be the best doctor for you. To ask around, and it doesn't have to be extensive research. Make some calls, call some other women and they can help you to do that, to make sure to do that. So to kind of, I don't know, take your time and don't feel like you have to make these decisions right away. I mean, you do, again, it's urgent, but you need to just ask for help. And like I said, ask other women and they'll tell you what their experience was and point you in another direction. And that's been the biggest resource for me. It's been other women with cancer that have given me the best advice. And I'd be happy if people want to reach out to talk about, different, what people are going through, or if they need advice, because I'm further down the line. I'm in follow-up care right now, so.
Yeah, thank you for adding that. I was going to ask you, the people that you spoke with, the other breast cancer survivors, were they mostly in your network, or were there any organizations that you reached out to or got connected with?
Not so much organizations, beyond the Cancer Foundation, but mostly just other women. Like, I just started calling. And also when I told some people I have cancer, and they said, oh, my friend had cancer and she, let me call her. And then they'd call and they'd say, where did you go? What did you hear? What do you hear about, who's a good doctor and who maybe wasn't so good, or what. Anyway, so yeah, it was just women that it just seemed kind of like exploded from, so some of the advice I got were women that I have never met before. And I don't know that I would see them, they're not in my social circle at all. It just kind of went that way. people are willing to reach out to people they know, who reach out to people they know, to just give advice.
Yeah, and I think that's so wonderful about our community is just that we, of course, many of us want to support and are willing to help with resources to be able to do that. Much like you do at DIW, they're trying to get resources to our community. And so in the last little bit, I just want to say for those again who don't know, Louise is a powerhouse in the community out here in Minneapolis, and I am definitely someone I look up to for many different reasons. And we are very thankful to have such a wonderful living ancestor in our community and to have you a part of Indigenous Pink, sharing your story with us. Thank you for doing that and offering up opportunities for others to connect with you. If anyone does have questions, I will type my email into the chat and you can reach out to me if you have more questions. And then, yeah, I guess I just want to see if there's any final words that you have, and then we'll wrap up.
Well, thank you for your kind words. That's really nice. I mean, I'm really, yeah, it's kind, and I'm grateful to be a part of this community, and particularly a really strong female community, Native women, a lot of good things happening, a lot of good support. So I'm really proud to be part of this community, and I appreciate being asked and being able to share what experience I can with folks. And I meant it, like, ask me, because that helped me so much. So I need to help other people. I want to help other people the way I was helped. So you can reach out to me, and and I'd be happy to help in any way.
Great. Thank you again, Chimigwich. Thank you to all of our attendees listening through Zoom and Facebook and wherever else you are virtually joining us in this space. Again, Miigwech, Louise, we will continue to celebrate Indigenous Pink Day here with another webinar right at 4. And so again, thank you all, and we will hopefully talk soon. Thank you, Louise.
Thank you, Miigwech, Giga Wabaman.
And